Hi everyone, my name is Carly McIlharney, and I'm going to tell you guys about Porphrymonas gingivalis. It's a bacteria that causes periodontal disease. So a little introduction to P. gingivalis. It's in the family Porphyrmonaceae and genus Porphrymonas. This genus was actually recently reclassified from bacteroids to Porphrymonas, and it's based off of the color change that occurs on blood agar plates when P. gingivalis colonies form. So I have a picture of it to the right over here, and you can see these black dots. These are the colonies on the blood agar plate. It's a gram-negative, non-motile, short-rod bacteria. It being gram-negative is actually really important for its pathogenesis, as well as it's an obligate anaerobe, which is very important for its establishing a location in the body for it to colonize and form. So specifically, it's going to get really deep into the gums where there's not a lot of oxygen. P. gingivalis is a major contributor to the periodontal disease, which could be gingivitis or periodontitis. So let's just talk about the difference between these two, because periodontal disease is an umbrella term. So gingivitis is the inflammation of gingival tissue, which is redness, swelling, bleeding of the tissue. And this is kind of intense bleeding of the tissue. You know, sometimes you'll go to the dentist and they'll floss your teeth and your gums will bleed a little bit. So that's not gingivitis, most likely. Gingivitis bleeding is more like whenever you brush your teeth, you start spitting up a lot of blood, or whenever you go into the dentist, if they poke you with the little tools and there's kind of a lot of bleeding. That's more like gingivitis. It's caused by dental plaque accumulation, and the attachment of the teeth is not affected, as you'll see with periodontitis. And it can last for a long period of time and not develop into periodontitis. And the only way that it could change to periodontitis from gingivitis is going to be if there's changes in the oral cavity conditions, which could be, no longer brushing your teeth or flossing, just no dental care at all. Change of diet, if you say you don't really have a carb-heavy diet, but you change to a lot of carbs, if you present a lot of sugars to these bacteria, they're just going to break them down for energy and produce acids. So that'll really help the development of a disease. Or individual susceptibility can cause this development as well. And that could be becoming immunocompromised and losing your immune system abilities, or even some genetic predisposition. Periodontitis is a plaque-induced inflammation of the periodontal tissue, so also the gum tissue, just a little bit deeper. And the bone and ligament of the area can be destructed, and that can cause tooth loss. So the alveolar bone and the periodontal ligament can be damaged or degraded by these bacteria, and that can just cause a tooth to just kind of fall right out of your mouth. And the periodontal pockets are going to form. So the periodontal pockets are degradation of the tissue around the tooth. And if the degradation is bad enough, these little pockets will form. And sometimes people are genetically predisposed just to have these pockets. So you don't have to have any gum degradation for these pockets to form. They could just naturally be in your mouth from genetics. So just to kind of show what these periodontal pockets look like, so here's a picture of a healthy tooth gum. You can see the nice pink gingiva. It's full, it goes all the way up to the body of the tooth. You can even see the tooth is really healthy and white and nice and pretty. For the diseased gum, there's major inflammation of the gingiva, and it's shrunken back and heavily irritated down into this bone, as well as this periodontal pocket has formed. So there's this excess space that is now available for bacteria to grow. And this is a wonderful place for bacteria to grow. They really like to get in that subgingival area, especially P. gingivalis, because it's that obligate anaerobe. And then thanks to crest, we have a nice comparison picture. So you have these healthy gums, they're nice and pink. They go all the way up to the tooth. Gingivitis, they're a little red. There's a little bit of gum recession and a little bit of swelling. And then severe periodontitis, you can see how the gums have receded a lot. There's a little bit of the bone showing here of the mouth, as well as these bottom parts of the tooth that you don't normally see in a healthy mouth. So the pathogenesis of P. gingivalis. How does it get to this point of periodontitis? So P. gingivalis actually exists in your mouth naturally. It's part of the natural microflora. So it can develop past being natural and living happily in your mouth into becoming disease-causing. So there's primary colonizers, which are mostly gram-positive bacteria, anaerobes or facultative anaerobes, and those are normally streptococci or actinomycin. And streptococci are actually the most prevalent bacteria that live in your mouth. So these colonizers come in, and because they can survive in the air that's in your mouth, you breathing in and existing there, they can grow and kind of create the basis. And then these secondary colonizers that are naturally there can start to grow too with the protection of the primary colonizers. So they're kind of hidden in the deeper pockets of your mouth or even just beneath the primary colonizers where there's little oxygen, and they create biofilms that they can live happily in with the sugars of your mouth. They're obligate anaerobes or even facultative anaerobes. They really don't like air, and they're normally Porphrymonas or actinobacillus. As plaque builds up in your mouth, secondary colonizers can exist more prominently and cause disease. So etymologically, studies of oral diseases, dental caries and periodontal disease, and a dental caries like a cavity, they show that these gram-negative rods cause damage and disease by working together. So I listed just a couple examples of things that cause these diseases, these gram-negative rods, and that's going to be actinomycin comitans, Forsythia, Prevotella, Fusobacterium, and P. gingivalis. So P. gingivalis doesn't act alone in creating periodontal disease, but it is the most prevalent and the most disease-causing. So these other bacteria work with P. gingivalis to help it kind of dominate and then cause disease. So P. gingivalis will keep breaking down the gum further and further until teeth fall out. The periodontal ligament is degraded, using the tooth to fall out, and there's these large pockets, as we've already discussed, surrounding it, so it's really easy. And with bone breakdown, so if it gets past, it can get into the bone, it'll start to break down the bone, like your jawbone and your alveolar bone. And this, plus the tissue degradation, can actually give access to bacteria to spread throughout the entire body and cause other health risk. As well as, colonies can be broken off from the tooth and gum surface with brushing, flossing, dental visits, and eating, which is great for combating periodontal disease. It can actually, just by taking care of it yourself, you can actually really help get rid of some of them. But this is actually kind of also bad for increasing the spread of it to other parts of the body or even entering the bloodstream. So it can break down the bone and get closer to the blood vessels in your skull and your cranial blood vessels. And then if you knock some of it off while you're eating an apple, say, then it can actually enter into the bloodstream. So specifically, how is it doing this? The virulence factors of P. gingivalis. There are many that affect how it's going to cause infection and disease. The capsule, fimbriae, aminopeptidase, lipopolysaccharides or LPS, and proteases. Capsule, fimbriae, and aminopeptidase are really helpful in establishing the bacteria, avoiding host immune responses, and allowing it to survive in the body. The capsule and fimbriae are just physical parts of the bacteria itself, and it can kind of help connecting to surface, kind of latching on. The fimbriae are really good about attachment, and the capsule can protect it from the host immune response. And aminopeptidase helps it break down iron, which is, they are obligates for iron, so they have to break down iron to survive. LPS and proteases, which are also called gingipains, cause the development and effects of periodontitis. So gingipains, these proteases, are released out of the bacteria, and they're directly involved in the colonization, getting in that periodontal pocket. So that's what those proteases, that's what's degrading the gum tissue. They're releasing out these enzymes that are just breaking down the tissue, and then they really open up that pocket or create that pocket for the bacteria to grow further and further down and cause more damage. They can also degrade extracellular matrix proteins like collagen, fibrinogen, and heme proteins. Lipopolysaccharides are molecules attached to the outer membrane of the gram-negative bacteria. So if you remember from the beginning of the summer, we talked about in the crash course for microbiology how gram-negative bacteria have the inner membrane, the thin cell wall, and the outer membrane. It's on that, which is specific to gram-negative bacteria. It's on that outer membrane that the lipopolysaccharides exist. So structurally, they have a distal polysaccharide, or the O antigen, a core oligosaccharide, and then a hydrophobic domain, or the lipid A, which is an endotoxin. And endotoxins are how gram-negative bacteria really cause damage in the body. So lipid A causes deregulation of the host's innate immune system. And that's really important for the bacteria to survive and keep causing problems in the body. It's going to deregulate this host innate immune system using chemokine pyrolysis. And essentially, chemokine pyrolysis inactivates neutrophils, eosinophils, and basophils. And those are really important to the innate immune system. And there's no more macrophages, like they're not really functioning properly, so the innate immune system isn't fully functioning, and it can't go to the active immune system and cause a host response to really eliminate P. gingivalis and prevent any more problems from occurring. Lipid A is also going to activate the inflammatory responses, and that's really important for P. gingivalis. So a lot of problems that are going to occur when it starts to infect the whole body and other issues is because it's a hyperinflammatory response is occurring and P. gingivalis is controlling that, not the body. LPS inhibits osteoblast mineralization and differentiation in the periodontal tissue, so that's what's causing the bone destruction. So the bones is being destructed because there's no osteoblast mineralization really occurring, and then even after that destruction, like it can't replace itself, and the bone cannot be reformed because LPS is preventing stem cell differentiation to make osteoblasts that function properly. And this is going to lead to the tooth loss, and again, that it can spread throughout the entire body with enough bone destruction. These virulent factors is what's going to cause the bacteria to increase dramatically. There's no innate immune system. It can spread throughout the body, and it can get really bad really quickly. 10 to 15% of the adults in the world have periodontal disease. So that's not really a dramatic number, but it does show that periodontal disease can affect the entire world. And in the US, 50% of tooth loss in adults over the age of 30 is caused by periodontal disease. Periodontitis occurs more in patients with systemic diseases, like diabetes, HIV/AIDS, leukemia, cystic fibrosis, and Down syndrome, and anyone that's susceptible to hyperinflammatory response. Because just as I just mentioned, it's because P. gingivalis is causing this inflammatory response, not the body controlling it. So it's a hyperinflammatory response, and if you're sensitive to those, as well as you have an immunocompromised patient, it is going to allow more periodontal disease to occur in those people, as well as harsher effects of the disease. Prominent secondary colonizers, those gram-negative rods, can spread person to person through saliva. So periodontal disease, gingivitis, and periodontitis isn't really known to be a communicable disease, but more and more research is showing that it's becoming one. As dental hygiene becomes really secondary to health, taking care of your teeth frequently, going to the dentist every 6 months, and just taking care of your cavities and taking care of your mouth, as that is becoming less and less important in human health to patients. Having this bacteria be able to spread person to person through saliva is really important and really shocking. So there's also some research showing that there's vertical transmission from mother to fetus through the placenta. And that's also important because, again, those hyperinflammatory responses, the things that are causing that response, can induce child labor. So it can cause preterm birth. It can also cause low birth weight because the mother is induced into labor because she has P. gingivalis causing her to go into labor instead of the actual child. So that's a lot of research is leading towards that, as well as babies can be born with periodontal disease or P. gingivalis already growing dramatically in their mouth because of that crossover of the placenta. And there's also signs of parent-to-child transmission with that genetic predisposition for those periodontal pockets, as well as the person-to-person saliva. The first step in treatment of periodontal disease and ridding the body of P. gingivalis is going to be a surface debridement procedure. And that's when you go into the dentist and they clean your teeth really, really well. And they basically use this like a little pressure washer for your teeth and do a lot of scraping. Sometimes they have to like numb part of you to really get in there. And while they're in there, they'll use chlorhexidine, which is an antiseptic. It's used in dental practices a lot. It's really effective. It's a broad spectrum antiseptic, and it's really good at getting rid of P. gingivalis. So if they can reach the spots of infection and where the colonies are forming, they'll use chlorhexidine. A lot of times when periodontitis is bad enough, they'll have to use antibiotics as well. So tetracyclines, macrolides, lincosamides, beta-lactams, and nitroaminodiazoles. And it's a long list because P. gingivalis is becoming more resistant to these antibiotics. But if the dentist can't reach it in the pockets of the mouth because it's too deep, or it spreads throughout the body, antibiotics are the first step that they're going to go for. But with increasing resistance to these antibiotics, researchers are looking for other ways to treat the bacteria infection. And that's going to be through quorum sensing inhibitors and antimicrobial peptides. Quorum sensing is how bacteria communicate to each other to create those biofilms, which is P. gingivalis and most microflora of the mouth create biofilms. It's that slick, sticky feeling in your teeth when after you eat food or when you really need to brush. So that's going to be those biofilms. And if you inhibit quorum sensing, they can't create those biofilms. And it's within those that they can start to grow and become prominent disease causing. And antimicrobial peptides, I have a true interest in these because I used to do research with them and working with P. gingivalis kind of hands-on. They're not straight antibiotics that are just killing the bacteria through like chemical means, but what they can do, some of them can do is the amino acids or the peptides can actually go into the bacteria and kind of destroy it from the inside. And the relevance of this is really amazing. So more than periodontal disease and a healthy smile and healthy gums, there is a connection for heart disease and heart complications with P. gingivalis. Patients with gum disease are twice as likely to suffer from coronary artery disease compared to those with healthy gums. P. gingivalis can enter the bloodstream and cause that hyperinflammation, which can increase plaque buildup. So with increased plaque buildup, as well as more of the bacteria being in the bloodstream, it can lead to blocking of arteries with that plaque. And it's working with Streptococcus mutans, which is what causes dental caries or cavities. There is an acceleration in erythroplaque formation and platelet aggregation, which is induced by them working together, and that can lead to thrombus formation, so blood clots. So there's increased plaque formation in the arteries and risk of blood clots if you have this infection of P. gingivalis. And there's also recent studies that show that 100% of patients with cardiovascular disease have P. gingivalis colonization in the arteries, and that's a huge statement. So that really shows that P. gingivalis is more than just infecting your gums, it's affecting your entire body. There's also been really recent studies with Alzheimer's patients. The article that I read came out in January 2019. So amyloid beta plaques have been found in Alzheimer's patients, like plaque buildup in the brain. It's kind of been a known thing for patients with Alzheimer's. And they finally figured out recently what amyloid beta is, and it's an antimicrobial. And then they dug around and did research to find out what is it fighting, what microbe is it fighting, and it was identified that it was combating P. gingivalis. It was also identified in these patients that they have an increase of gingipane concentration in the brain. And the gingipane, this protease as mentioned earlier, are actually targeting the tau protein to degrade it. And the tau protein is really important for proper microtubule structure, for the neural axon function, and cell communication. And so without these brain cells are going to die. And it was known for a while now that the tau protein in Alzheimer's patients was bad. They knew that there was something wrong with it, and that was causing a lot of damage and a lot of the symptoms and problems with these patients, but they never knew what was causing it to be bad. So now with this research, it's kind of pointing towards P. gingivalis. So I just thought that was really interesting, showing this recent research that is about P. gingivalis. I hope you enjoyed my presentation. This made me excited, and then actually I'm going to end on a slide of some pictures of periodontitis and gingivalis. So if you don't like bad teeth pictures, don't look at this. Thank you.